Arc, Florida, and this morning we're digging into a promising new therapy that's being used to treat everything from wrinkles to some types of cancer and inflammation, pain, all connected to chronic conditions.
That's right. If you have scrolled social media recently, there's a chance you might have seen someone using this, or perhaps it's been advertised to you. These red light masks and red light devices that you can buy to use at home go for hundreds of dollars online, and now medical spas are popping up with options to pay for a red light therapy session. But what exactly is red light? Is it safe, and does it work?
Well, Stephanie Valderrama has been digging into this technology and has more.
I just love doing it. I feel great when I'm done.
For 15 minutes a day, 2 to 3 times a week, Kim Boyer sits in this red light therapy room.
All right, Kim, so we're gonna go ahead and start your session.
She's been doing this for about 4 months now.
How did you first hear about red light therapy?
Probably social media.
Intrigued by what she saw online, a quick Google search led her to a medical spa in Palm Beach County that offers this service. So she decided to give it a try.
I've got some serious arthritis in my shoulders and my neck, and I'm probably getting closer to surgery, and I just don't want surgery. So I'm trying to do any preventative that I can.
How long have you been dealing with that pain?
A very long time.
Have you noticed a big change?
I have. I think it's less inflammation, yeah, which is obviously taking the pain away. So I don't take the naproxen anymore, which is an ibuprofen over the counter. It's really benefiting the joints, I think, and the muscle, and my neck as well.
Shauna LaCroix, a registered nurse that works at the Drip Bar Medical Spa, explains there's a lot of uses for red light therapy.
So some of our clients come to us and they can be dealing with like chronic inflammation, arthritis. Some people are dealing with maybe some alopecia, having difficulties with their skin. It can benefit a lot of people, from your professional athletes with speeding up the recovery, or your elderly people with chronic inflammation and pain.
So is this therapy too good to be true? According to the Cleveland Clinic, the therapy is showing potential, but more studies need to be done to conclusively say one way or the other. Now, we spoke with Dr. Jason Heckman of the Tampa General Hospital Cancer Institute. He explains how red light therapy works.
Anything that's going to draw more blood into an area of the body is going to bring more cells into the body for healing potential. And so red light, because it does cause an inflammatory reaction into a local area, it's going to bring more blood flow into the region to help heal certain situations.
Since red light activates the cells, Dr. Heckman says it also helps with collagen reproduction, which can soften skin and reduce fine lines, making it very popular in the world of beauty. And that's been Kim's experience too. She is seeing internal and external changes.
My skin, the blemishes are just disappearing. It feels softer. Definitely the wrinkles, I think, are tightening.
As more and more people look to less traditional methods of treatment, red light therapy is becoming more popular. But Dr. Heckman warns you should make sure you don't skip out on traditional medicine. Now, currently, red light should only be treated as an additional tool, not a cure, due to lack of medical evidence that supports that it can cure. And while Dr. Heckman doesn't currently use the therapy for his patients, he's ready to explore it since it's being used as an additional tool to treat skin conditions and more superficial types of skin cancer.
For the skin lesions, for the precancerous, for the squamous or the basal, there's good data. But again, the red light itself is not what's treating those lesions. What's really great about it is it focuses into the precancerous and cancerous cells, the photosensitizing agent, so the surrounding cells, which are normal, are not damaged at all.
In Kim's case, she spends up to 45 minutes a week in this red light room. So is too much of a good thing not a good thing?
Could it be toxic to us?
No, it has no toxic effects. It's a short wavelength, so it penetrates shallow. It does not reach and go deep and cause DNA damage.
Pretty cool, right?
Yeah, that's fascinating.
Yeah, so at least at this medical spa, they have a pretty rigorous onboarding process before you're ever even allowed in these red light rooms. So that's obviously, you know, very important and helpful. And, you know, they start, because of the way the wavelengths are with this red light, they start very small, so at a lower frequency, and that's how you sort of get started before they up the frequency.
Well, I'm curious because, you know, we started this talking about, you know, social media. A lot of us have seen people buying the red light masks that you can just use at home. But, you know, are these doctors saying anything about the difference between the at-home equipment and going to a medical spa, whether, you know, one is safer than the other?
Yeah, so according to Dr. Heckman, he explains that regardless of whether you're going to a medical spa or, you know, you're being advertised these red light masks on social media, you should look and make sure that whoever is producing them is sort of certified by some strict agency, because you might think you're getting a good deal, but you know, getting a good deal is not always a good deal. And just to, another important note is I want to share is that Cleveland Clinic says also misusing these. We really don't know the long-term effects of this, so that's something really important to keep in mind as well.
Interesting. And obviously this is not something that's covered by insurance, you know, so I'm imagining if you're going into a spa and you're spending 45 minutes in there, that it's got to be pretty costly. You know, is this really just like, is it just a red light? Is it just a light going through a filter that's like, you know, I mean, we were joking around in the back, you know, with like putting like our red film over the light and that being, you know, possibly healthy for us. It really is just
a red light.
A red light.
Yes, yes.
Interesting.
And it's just, it obviously varies on the frequency. So somewhere like a medical spa would have more options to increase the frequency, but something like, you know, a mask that you bought on social media, you wouldn't be able to necessarily do that. It might have like a, you know, low, medium, high, but it would be totally different than something that is done at a medical spa. It's also really cool that at the medical spa, depending on what part of your body it is that you're sort of wanting to treat, they might put you closer and even further away from the actual red light, but it obviously is a progression. That's not where you're starting.
Yeah, I just think it's fascinating that it's going beyond the skin, that it's helping people with
Yeah,
arthritis
that really
and
is
inflammation, and it's not just like a beauty, you know, a wrinkles thing, that it's actually really helping. It's fantastic.
And that's how I sort of, you know, stumbled into this as well, is like I initially saw people wearing these masks and thinking, oh, it must only be for your skin, but then learning that that's not exactly what, you know, at least Kim Boyer is using it for. So kind of interesting, and then hearing from Dr. Heckman that he might look into it, you know, as an additional tool for his patients. So a lot yet to be studied, but it seems promising.
Very interesting. All right, good stuff. Thanks, Steph.
All right, well, not your average dash cam video. In today's Caught on Camera, we've got a wild police chase that includes horses. We're going to show it to you next.